All right, let's dive right in. Today, we are cracking open the government's 2026-27 expenditure budget. But we're not just going to be looking at a bunch of dry numbers. Nope, we're going to follow the money trail and see exactly where it's all going and, more importantly, how it's meant to shape the country's health and social well-being.
At the end of the day, a budget is really just a statement of priorities. So the big question we're tackling here is pretty simple. How does a government actually use a financial plan, all these crores, all these allocations, to build a society that's healthier and fairer for everyone?
To figure that out, we're going to go on what I like to call a follow the money trail. We'll start way up high with those huge ministry-level numbers, and then we'll trace that funding all the way down to the specific programs that actually impact people's lives. We're talking everything from your local clinic to student scholarships.
Okay, let's kick things off with our first major theme, the absolutely massive investment in our national health. And this is about so much more than just pills and prescriptions. It's about building the fundamental infrastructure for a truly healthy population.
So, here's our first headline number, over 13,000 crores. Now get this. This money isn't for paying salaries or buying medicines. This entire amount is specifically for creating new capital assets for the Ministry of Health. Just think of it as the budget for building the physical backbone of our healthcare system. New hospitals, advanced labs, modern equipment, the works.
So where does a huge sum like that actually go? Well, this slide gives us a peek behind the curtain. Almost 3,000 crores are getting poured into a flexible pool to strengthen our health systems all across the country. Another 1,700 crores, that's going towards training the next generation of doctors and nurses. And you can see a real focus on excellence here too. 860 crores are set aside just for establishing new AIMS, our top-tier medical institutes.
Now let's see how all this funding trickles down into a scheme you've probably heard of. Ayushman Bharat, or PMJA, is a perfect example. See, this program isn't about building the hospitals. It's about making sure people can actually afford to use them. It's a massive health insurance plan for hospitalization. And as you can see, its safety net is getting even wider to cover our essential frontline health workers and millions of our senior citizens. So just like the budget is trying to make healthcare more accessible, it's also got this huge push to create a more just and inclusive society. Because really, health and social justice go hand in hand. A big chunk of this budget is aimed squarely at empowering all kinds of different communities. And here is the number that really backs up that commitment. Over 15,000 crores. That's the total allocation for the Ministry of Social Justice and Empowerment. When you see a number that big, it sends a pretty clear signal about the government's priorities. And this is just a brilliant illustration of how that money gets targeted. It's not just one big pot. Within the overall health budget, specific amounts are ring-fenced for different communities. So we can see over 10,000 crores for health schemes benefiting scheduled castes, and almost 4,500 crores for those benefiting scheduled tribes. This makes sure that the funding is actually reaching everyone. Social justice is also about creating opportunities for the future, right? A great example is the PM Yasasavi Scholarship Scheme. With a budget of nearly 100 crores, it's directly funding the education of top-achieving students from OBC, EBC, and DNT communities. It's a direct investment in our next generation of leaders. And the investment in our youngest citizens, it's enormous. Check out this number, nearly 20,000 crores. That's the total money for this Saksham Anganwadi and Poshan 2.0 scheme. This one single program is fundamental to tackling child and maternal welfare head-on, focusing on everything from nutrition to health to early education across the whole country. Okay, so we've seen all these massive numbers, but here's the thing, and it's a really critical point. Just spending money is not the goal. What we're seeing is a fundamental shift in philosophy, a move away from just tracking spending to actually measuring results. It's all about connecting the money to a real mission. Now, to really get this shift, you have to understand these three words. First, you've got the outlay. That's the easy one. It's just the cash, the money allocated in the budget. Then you've got the output. That's the direct, countable thing you get for that money, like we built 100 clinics. But the outcome? Now, this is the most important part. This is the real-world change you're actually trying to make, like healthier families or lower malnutrition. The whole goal is to move the focus from the outlay to the outcome. So let's apply this idea to that huge Saksham Anganwadi and Poshan 2.0 scheme. The outlay is a massive 23,100 crores. What's the direct output for that money?
upgrading 40,000 Anganwadi centers. But what's the real mission, the desired outcome? It's a measurable reduction in childhood wasting. See? That's how you draw a straight line from a number in a budget document to a life-changing goal.
And it's the exact same story for the National Health Mission. The outlay comes from that flexible pool we saw earlier. The output isn't just to have a bunch of buildings, it's to get 50% of our public health facilities quality certified. And why does that even matter? Well, the outcome they're shooting for is a 10% increase in patients who actually use these certified facilities. That's proof that when you improve quality, you build trust and get more people the care they need.
So, after following the money and trying to understand the real mission behind it, what does all this really mean? How does this high-level budget stuff connect back to you, to me, to all of us? So let's wrap it up with the key takeaways. First, this budget has a two-pronged approach. It's building hard infrastructure for health while also strengthening those social safety nets. Second, the funding isn't just one giant pot of money. It's strategically aimed at specific communities and their needs. And I think this is the most important part, we're seeing a big shift towards accountability. The focus isn't just on the money going out the door, but on the real-world results that money brings in. The mission is to make every single rupee count. And that leaves us with one final thought to chew on. A budget is the financial blueprint, right? It's the outlay for building a healthier, more equitable nation. But that plan is just the beginning. The real question is, what are all the factors on the ground, from how it's implemented to how people participate, that will ultimately turn these ambitious plans into successful outcomes for everyone?